Good afternoon, Solve.Care community. This is Pradeep. I'm the CEO of Solve.Care. Many of you know me well. I've been asked by my team to answer 7 questions that the community is anxious to get some information about. So I'm happy to go through each of these 7 questions and provide you an update. I'm in the Kiev office and I'm very excited to speak with you all. As many of you know, he was visiting us in the Kiev office over the last 3 days. And it was a great visit for a number of reasons. The first is that the whole team got to spend time with Dr. Hanekam in a one-on-one long session where he shared his vision, excitement, and purpose of adopting Solve.Care platform and why in Arizona Care Network's mind, we will transform healthcare for patients and providers, not just in Arizona, but in the US and globally. And the team got to ask him a lot of questions. He answered them very candidly, and he left everyone inspired by his bold vision for how he plans to use our platform. The second thing was that he got to meet the team and see the progress that we have made, and his comment to me was, this company has made tremendous progress and strides in a very short time frame. And as young as we are certainly a very mature organization, and he noticed and commented on that. And the third was that he and I spent a lot of time one-on-one together, and we planned out what 2019 looks like, what 2020 might look like, and where the opportunities are to go beyond the original scope. And that's the best kind of meeting when a client and the executives can sit together and plot not just the immediate deliverables, but deliverables that follow and many sequences and many versions of releases. So overall, I think we are all very pleased that he was able to invest the kind of time in us and that we were able to take full advantage of his trip here. I'm very thrilled, and I look forward to meeting him again in Washington, D.C. when I see him next week at the Healthcare on Blockchain Summit in D.C., where both of us will be presenting. Originally, we had planned to release a consumer wallet in Q4. We have accelerated that release to Q3. The team has worked very hard to deliver us the first consumer wallet. I reviewed it, Dr. Hanekam reviewed it. We have some suggestions and comments that are being incorporated, and it's going to go through a testing and compliance process. I will give you a firm date on release of the consumer wallet over the next couple of weeks. I am still confident that we will release the wallet within this quarter, and I want to make sure that the wallet goes out in a manner that is relevant and very compelling for all the consumers, not just in the US, but around the world. So we are very excited about the progress that has been made. Some work needs to be done, and that will get done over the next few weeks, and we will publish a new release date when I provide you the next update. This is a very important question, and I want to give you a detailed answer. The first, Solve tokens that are in the hands of consumers need to be consumable through the consumer care wallet. So it is very important that the wallets and the tokens are in the market simultaneously, and we're working hard to make sure both happen at the right time. The second is that our clients, institutional clients who need to accumulate millions of tokens in their wallet to use our platform, have some kind of a structured approach to acquiring these tokens. We are working with a number of options and a number of third parties to figure out the best way for our clients to have the ability to acquire and manage these tokens. That journey is nearing a completion. We have a number of excellent options that we are working through, and as soon as we have the final structure in place through which our clients can manage their token acquisition and token management, we will then have one more reason to move towards unlocking our tokens. And the third reason that we need to address is we must have the swap completed. While that's not the only concern, we absolutely must not allow for CAN tokens and SOLVE tokens to coexist. So I encourage all of you, those who have not swapped their CAN tokens, to do so at the earliest possible convenience. The confluence of these 3 things, consumer wallet, client ability to acquire tokens, and the CAN tokens being swapped, is in my mind the necessary steps towards the milestone of unlocking these tokens. When will they be unlocked? It depends on how quickly we can get through these 3 milestones, but I'm very hopeful and optimistic that we can do it quickly. And I'm looking forward to giving you an update in a couple of weeks on how much progress we have made on all the 3 fronts: the consumer wallet release, the client token management and acquisition model, and the swap of the CAN versus SOLVE. Once we get through those 3 steps, we should be in a great position to unlock the wallets and to launch a very robust economy into the market. Our approach to the airdrop tokens has been that 30 days after the tokens have been unlocked, the wallets have been unlocked, we will put the airdrop tokens in all the wallets. The programming for that has been completed, was completed a while ago. It's simply a matter of triggering the event that will deposit the airdrop tokens into the wallets, and that is scheduled to happen 30 days after the tokens are unlocked for all the general wallets. So stand by for that. Obviously, it's related to when the tokens are unlocked is when the airdrop will occur. An update on the Care Card contest. As you all know, we launched our first Care Card contest around the design of 3 Care Cards. And I'm very excited, very happy to report that over 250 participants are in the contest from 30 plus countries. That's great, because we knew that the first contest we will learn a lot from it. And we know that there are dozens more cards that need to be designed, and they will all go through a similar mechanism of incentivizing and engaging our community. So we learned a lot from this contest, and while it is a success, I'm quite confident that lessons learned from this contest will lead to much better participation. And while we are very happy with the 250 participants in this contest, I want to see the next contest to have thousands of participants. And we are making progress towards learning, planning, and executing many contests followed by the current one. We have had a tremendous July. It feels like it has been years since we entered the token sale. It's only been a few weeks. Great progress on the product side. The product management function, the product development function, the product development capacity are all improving and getting better, where I'm happy with the progress we're making there. Very good progress on the pipeline. We have gotten into much more detailed discussions with our clients. Our use cases are resonating with our clients. We are in contract negotiations with at least 2 major insurers that we hope to announce over the next few months. And finally, on the partners, we are about to announce significant partnerships that will capture your attention and attention of every major healthcare player in the world, because we are bringing partners into our ecosystem that dramatically enrich the capabilities of our platform. And then finally, on the people side, we have added an operations executive who actually started this morning, and her responsibility is to handle all the back office operations of the company. And she brings tremendous experience and expertise in operations, IT, growth management, and people management, so that I can focus more on strategy, on clients, on delivery, and she can focus on more the underpinnings of the company. We have reconstituted and expanded our product management function, as I mentioned earlier, and we have dramatically expanded our development capacity, both internally as well as new development partnerships that we have forged in several different continents. So we now have a much broader pool of people working internally and externally on the platform, on the wallet, on the cards, on the protocol, and I'm very excited to see the progress we're making. But the most important thing that I want to share with you is this. I'm on the road talking to clients all the time. I'm on the road talking to partners all the time. And what I am seeing and hearing is the same theme. Wow, what Solve.Care is building is truly innovative. This is the most powerful use case of our blockchain we have seen in healthcare or really in any other industry. And when you guys say you're about to change healthcare for the world, not just in the US but globally, by golly, you have a plan. I am more confident than ever that our platform is going to be one of the most important healthcare implementations and one of the most important blockchain implementations, because it's healthcare, because it touches every one of us, and because our architecture, our design, and our plans are solid, and we have the ability to execute. So we will dominate the healthcare sector, and we will deliver what we have promised today and in the future. So stay with us, enjoy the ride, because this is going to be one hell of a ride. Thanks, everyone.